Sweetser, one of Maine's largest community mental health providers, is vying to develop the state's first psychiatric residential treatment facility for kids and youth with severe mental health needs.
The 16-bed facility would provide round-the-clock care in a secure setting, and advocates say it's a crucial step forward to try to fix a broken system. News Center Maine's Vivian Lee has our update tonight from Saco.
This 8,000 square foot two-story building on Sweetser's Saco campus could be the new home to Maine's first psychiatric residential treatment facility, or PRTF. Sweetser is competing with other nonprofits and behavioral health care providers for $2 million in capital funds. That funding would be used to retrofit the building, which currently houses residential units, into a secure 16-bed facility. Sweetser President and CEO Jane von Bremer says the nonprofit is submitting an application after DHHS officials said it would offer sustainable Maine care rates. She says the facility for children and youth under 21 with severe mental health issues will have psychiatrists, clinicians, crisis workers, and nursing staff available 24/7.
A lot of interventions to work with the children and their families, so there'll be family therapy.
Von Bremer says the facility could help bring home some of the 70 Maine kids in treatment facilities as far away as Arizona.
It will allow us to prevent kids from going out of state, and it will allow us to take kids out of ERs that are.
Katie Harris is the Chief Government Affairs Officer for Maine Health. She says the state's largest hospital system is grateful that establishing a PRTF is closer to becoming a reality, as 120 children remain on a waiting list for an inpatient bed in and out of state.
Those children are languishing in the wrong care settings as a result of the lack of access to residential treatment.
Over the last 5 years, Maine has lost more than 150 beds in programs that treat kids with mental health problems and special needs. Last September, Maine Health Spring Harbor Hospital closed its 12-bed behavioral health unit for children and youth with developmental and intellectual disabilities. Harris says it will reopen sometime in the future with a new care model.
And it's going to really be more effective and efficient in the care that it provides.
Jessica Reed's son Brody is nonverbal and is on the autism spectrum. She says his severe behavioral needs leave him in continuous crisis. He's currently waiting for a bed at a residential treatment program in Maryland, but she is hopeful a PRTF means he could stay in Maine.
They will be able to keep him safe easier. They're well equipped to do that, to keep him in a safe environment, to keep him regulated. I would consider putting him there for that reason.
The deadline to submit a proposal is later this month, with DHHS expected to announce the recipient of the capital funding sometime in April. In Saco, Vivian Lee, News Center, Maine.